Back to Squawk Box. Software engineers are said to be making progress with the troubled Obamacare website, but will it be too little too late for the economy? Lamar Alexander, ranking member of the Senate Health, Education, Labor, and Pension Committee, joins us now with more on the fallout. Good morning to you, Senator.
Good morning.
So how do we fix this thing? Or what happens next is the big question.
Well, first thing is to try to put the president's promise into law. And Senator Johnson of Wisconsin has a bill to do that permanently. The president wants to do it until after the next election, but at least with the 5 million cancellations that we've already had, we try to make it possible for many of those to keep those policies so there'd be fewer Americans hurt. Although the truth is that the horse is already out of the barn for a lot of those people, and it's not going to be possible for them to keep those policies.
Senator, you know, from the Republican position, is the goal to let this thing, hopefully, I would imagine, from your party's perspective, fall under its own weight? Or do you think there's going to be a real push come next year to try to get rid of it completely all over again?
Well, it is falling of its own weight. Our purpose is, number one, to try to keep Americans who are being hurt from being hurt too much, such as with Senator Johnson's bill to put the president's promise into law. The second thing is we want to show the American people what we would do if we were in charge. I mean, we'd move in a different direction step by step instead of trying to change the whole thing all at once, as Obamacare did and as Hillary Care tried to do. So we would try to move toward more competition, more choices, right, cheaper policies. That would allow Americans to actually buy affordable health care insurance.
I understand that, but as you said, the horse is out of the barn or the train's left the station or whatever you want to, whatever phrase we want to put on it.
I'm writing them down.
And therefore, then the question becomes, how do you fix what is a challenging situation as opposed to completely rewriting everything from the beginning?
Obamacare is almost impossible to fix because it goes in the wrong direction. But it's only part of the health care delivery system. What we can do is start moving step by step with that same health care delivery system and make insurance more affordable. I mean, for example, small business health plans allow small businesses pool the resources, offer insurance by spreading the risk. We've got a plan for that. 750,000 more Americans would be covered. 3 out of 4 would pay less for their insurance, according to the Congressional Budget Office. So we have a whole series of these steps that we would take toward less expensive insurance, but it's a different direction than fixing Obamacare.
I guess, Senator, the question becomes, what do you do with the changes that have been put in place to this point? Would you still insure people who have pre-existing conditions? Would you still allow kids or people who are 26 years and under to stay on their parents' health insurance up to a certain point? Would you keep any of those provisions, or would you basically throw out everything that's been put in place?
Well, you go step by step. I think on the 26, allowing children to stay on their parents' policies isn't really very hard. Many insurance companies are doing that. Pre-existing conditions is harder. But if you're a 39-year-old woman in Tennessee with lupus, if you're allowed to buy a plan that's regulated in Kentucky that offers you limited benefits, and it fits your needs, and you can afford it, that helps you with a pre-existing condition more than the Obamacare plan, which causes you to have your policy canceled. We literally had 16,000 such policies canceled in Tennessee because they didn't meet the standards of Obamacare.
One of the biggest problems we have in this nation, though, is the problems from health care and the costs that have continued to grow. Now, Obamacare doesn't address a lot of those issues. This was more about getting coverage for people. But there are some major problems with the health care insurance industry and with health care pricing that continues to go up. How do you tackle that?
Well, you competition, choice, and lower prices. I mean, if the president says employers have to offer more expensive insurance, the price goes up. If the president says, as Obamacare does, that you can't keep your policy unless it has all these certain benefits, 5 million are canceled, and the price goes up. So you can't offer more benefits if the price doesn't go up. What you have to do is say, let's allow people to buy their insurance across state lines. Let's have small business plans. Let's make it easy for employers to give cheaper insurance to employees who live a better lifestyle. Let's expand health care savings accounts. Let's put Medicare into competition with Medicare Advantage. See, it takes a while to say these things, but this is the direction. This is the plan for more affordable insurance that actually works.
Okay, Senator, assuming that you're right, or that you want to go in this direction, just tactically walk us through the politics of getting there, given where we are today. What are you and your party prepared to do to get there, and how would it even work?
One is to put the president's promise into law. Hopefully, we'll find Democrats who agree with us on that. There may be other things we can do in the short
Democrats
term.
agree with you on that?
Well, I hope so. I would think they would. I mean, if they got 5 million canceled insurance, it's hard to uncancel 5 million insurance policies, which is the number already. And when the employer mandate kicks in, the requirement that employers provide a more extensive and more expensive set of insurance, you're going to have millions more of people without insurance. So maybe Democrats will join with us. The second thing we have to do is elect 6 more Republicans to the Senate and a Republican president, take charge of the government and fix the law.
Well,
that's the way we do it in our constitutional
I understand
system.
that, but real quick before we go, come January and February, when we have conversations all over again about the debt ceiling and everything else, is this going? How much of the conversation is it really going to be about this again?
That's separate. I mean, the debt ceiling is a different issue. Obamacare is the central issue. We're going to try to minimize the pain. And over the long term, we're headed in a different direction with competition, choice, and lower prices for people who want to buy insurance.
Okay. Senator Alexander, thank you for joining us this morning.
Thank you very much.
Thank you.